In the high-stakes world of critical care, seconds matter. When a patient's life hangs in the balance, a systematic approach is crucial. The ABCDE approach provides a structured framework for assessing and stabilizing critically ill patients. This mnemonic, representing airway, breathing, circulation, disability, and exposure, guides healthcare providers through a prioritized sequence of life-saving interventions. By adhering to this systematic approach, medical professionals can rapidly identify and address life-threatening conditions, improving patient outcomes in even the most challenging situations. A patent airway is paramount for survival. The first step in the ABCDE approach is to assess the patient's airway for any signs of obstruction. Look for chest movements, listen for breath sounds, and feel for air movement. If the patient is conscious and talking, the airway is likely clear. However, in unconscious or compromised patients, immediate intervention is necessary. Simple maneuvers like head tilt chin lift or jaw thrust can open the airway. In more complex situations, advanced airway management techniques such as endotracheal intubation may be required to secure the airway and ensure adequate oxygenation. Once airway patency is established, the next priority is to evaluate the patient's breathing. Assess the respiratory rate, depth, and effort. Look for any signs of respiratory distress, such as the use of accessory muscles or cyanosis. Auscultate the lungs to assess air entry and identify any abnormalities, such as wheezing, crackles, or absent breath sounds. Supplemental oxygen is crucial for patients with compromised breathing. The method of oxygen delivery depends on the severity of the condition, ranging from a simple nasal cannula to non-invasive ventilation, or even invasive mechanical ventilation in severe cases. Circulation, the body's highway. Circulation, the lifeline that delivers oxygen and nutrients throughout the body, demands immediate attention. Assess the patient's pulse rate, rhythm, and strength. Check the blood pressure and capillary refill time to gauge perfusion. Look for signs of shock, such as pale or clammy skin, altered mental status, and decreased urine output. Intravenous access is crucial for administering fluids, medications, and blood products. Start with fluid resuscitation using crystalloids to restore blood volume. For patients with hemorrhagic shock or severe anemia, transfuse packed red blood cells to improve oxygen delivery. If fluids and transfusion are insufficient, initiate vasopressors like norepinephrine to stabilize blood pressure. Consider inotropes such as dobutamine for patients with low cardiac output. Disability, assessing neurological function. Disability, in the context of the ABCDE approach, refers to the patient's neurological status. A quick assessment of the patient's level of consciousness, pupil size and reactivity, and limb movements can provide valuable information about the brain's function. The Glasgow Coma Scale, or GCS, is a widely used tool to assess the level of consciousness. A decreasing GCS score indicates a worsening neurological condition, requiring immediate attention. Addressing underlying causes such as hyperglycemia or intracranial bleeding is essential to prevent further neurological deterioration. Exposure, unveiling hidden dangers. The final step in the ABCD approach is exposure. While maintaining the patient's dignity, a thorough head-to-toe examination is crucial to identify any obvious injuries or underlying medical conditions that may have contributed to the critical illness. Look for rashes, wounds, or other skin abnormalities. Check for medical alert bracelets or necklaces that may provide valuable information about the patient's medical history. Maintaining body temperature is essential, especially in patients who have been exposed to extreme temperatures or have significant blood loss. The ABCDE approach is a fundamental framework for managing critically ill patients. By following this systematic approach, healthcare providers can rapidly assess and stabilize patients, improving their chances of survival. Remember, in the fast-paced world of critical care, every second counts. The ABCDE approach provides a roadmap for action, guiding healthcare providers to deliver timely and effective care that can make all the difference in a patient's life.